Last week, Congress took a first step toward repealing the Affordable Care Act without any replacement at all. Not only does this approach fail to tackle the many tough trade-offs that come with real health care reform, it doesn't even succeed in delaying them. In the United States, to call for national health insurance reform. And so today, here are three things that would happen. First, as I've said before, the Affordable Care Act is if it's repealed without a replacement, the damage to the country's individual insurance market will begin this spring. If health insurance companies don't know what the market will look like going forward, many will either raise prices or drop out. That means more Americans won't be able to afford coverage, and others won't be able to find it at all.
And we're going to dig a little deeper, I think, in some of the points you raised. But of the proposals out there...
Second, states and hospitals will be in budget limbo. Governors of both parties have said that repeal and delay would create unacceptable uncertainty for their state budgets and their states' economies. Meanwhile, some rural or community hospitals will have to shrink or even shut down if they can't count on funding through Medicaid. And third, if Congress never enacts a comprehensive replacement, the consequences for American health care are quite stark. We would not just go backwards, we would fall behind where we actually started.
Thank you very much, Madam Secretary. Just a quick reminder for the C-SPAN and public radio.
With no replacement, experts have estimated that 30 million Americans would lose their health insurance, 10 million more than the number who have gained coverage through the Affordable Care Act. And that's because the congressional repeal plan could lead to the unraveling of the individual market. And our only chance of not going over that cliff depends on opponents of the law doing in the next 2 years what they haven't done in the past 6. Develop a comprehensive replacement plan.
I want to start off with, and we're going to dig a little deeper, I think, in some of the points you raised. But
I think we haven't seen a real proposal for replacement. We have not seen, that's, I think, what this conversation is about. We have not seen a plan that can be measured or scored to answer the three fundamental questions that I articulated. We need to know, what does it do to access, the number of insured? What does it do to affordability in terms of premiums and costs to the federal government? What does it do in terms of quality? What benefits are preserved? And I want to focus on how these choices will impact Americans' lives. This isn't about Washington, D.C. This is about one of the most important things in every person's life. The basics of your health, how you're going to keep it, and how you're going to do something when it's not there.